This is Dr. Garcia again, here to discuss the most common questions that people Google regarding herniated discs and Ivdd surgery. So the first question is, what is Ivdd? Ivdd is the condition where we have disc herniation that can happen most likely either in the cervical region or the thoracolumbar region. Once that we have the herniated disc, then we're going to have loss of neurological function, but also pain. The next question is, what is the success rate? I call it the 90-50. If it's a situation where we haven't lost all our neurological sensation, we at least have deep pain, then it's probably around 90%. However, if we have lost that deep pain perception, but it hasn't been more than 24 hours, then in that space, it might be less than 50% that we're gonna have a good recovery. The next question is risk and complications that we can have with the procedure. So one of them might be that we don't get the full recovery that we want. We always, of course, our goal is for these dogs to get back to walking and being able to have their normal lives. So issues that we can have, one of them can be bleeding, and that can be managed. The other issue that we can have is something called myelomalacia. In that case, what's happening is that spinal cord starts to necrose, starts to die off, and in many cases, unfortunately, that can be fatal. The other issue that we can have is a second location. So when we do the imaging, whether it's CT or MRI, we always try to see where the location seems that is most affected. Even if it's actually two locations next to each other, then we can address those. But however, in some cases it can be in completely different areas, and we want to tackle, we tend to pick the one that seems like it's affecting more acutely, and that's the one we're going to tackle. In some cases, however, that might not be enough, requiring a second procedure to remove the disc on the other area. The other question that people ask a lot is, what is the cost? And how do we diagnose it? And also, what do we do to be able to diagnose it? So the cost can vary a lot. I believe, one of the more affordable areas or places that we do it is at our facility, which is around $4,500. There can be places that can be as much as $15,000, $20,000. And the reality is every place is different of what is included in that. And ours is basically the bare bones, what we need to do the procedure and hopefully get these patients back on track. Many of the other places also include post-op care that some people want to have them take care of. But again, some people say, okay, I want to get the surgery done and I can help and do the rest of the post-op care at home, or maybe after one day of overnight care somewhere in the area. The pre-op preparation, what we do is we put them on the general anesthesia, do CT scan in our place. Some people will do the MRI. Once we use the CT scan, we can determine where the location is for the herniated disc, and then we do the procedure to remove that herniated disc. The other questions that were asked is kind of what the recovery entails. So basically, for the first 8 weeks is strict activity restriction, basically in and out to the bathroom and going back in and just resting. During that time, there are different instructions that we can give you guys to little by little kind of ease into feeling more comfortable of starting to walk again and everything. But basically, it's important to know that it can take up to 6 months to see, or sometimes even longer than that, to see how much we're gonna get out of the procedure, how much nerve recovery we're gonna be seeing. The other question that we get asked is, what are good candidates and which ones are poor candidates? Typically, the good candidates are ones that, of course, have not lost that deep pain perception. So anything from just being painful to still, to having the paralysis on the legs, but still having that deep pain will be good candidates. As we said prior, typically we should have about a 90% recovery of those cases. Poor candidates are the ones that we've lost deep pain, and however, the ones that are not gonna be good candidates at all are gonna be ones that have been over 24 hours since we had the issue. Then those likely we won't be able to get much benefit from doing the procedure, unfortunately.